I want to thank you very much for attending this webinar. I welcome you to this learning experience that is sponsored by the Repair Stem Cell Institute. Mr. John Margolis will be someone you probably will be familiar with. We have two guests, Dr. Toot, who's calling us actually on the webinar from Bangkok in a clinic there, and David Gronowski, who will be introducing in just a moment. Before I continue, I want to acknowledge one thing in you for having the curiosity and the courage to explore another option. You know, in this world we're given too many options, aren't we? And too many of them lead us down a road that goes nowhere. Our purpose in this session is not to sell you anything. It's not to convince you of anything. It's to give you some good information and good data so you will be in a position to work with your medical advisors, the people that you work with to make medical decisions in your life, and come to a determination if this information that's being presented here today is relevant for you and it's something you would like to explore further. So without further ado, I'll adjust my notes. I have some notes in front of me, but first of all, I'd very, very much like to introduce someone that I work with almost on a daily basis right now. My name is Duncan Kirk, and I want to introduce to you Mr. David Gronowski. Now, David is a consultant in the field of stem cells. He's worked with some of the top doctors and scientists all over the world. He's a researcher. He's a writer. He's developed over 2,000 articles, scientific papers, white papers. Recently, a scientific journal article. He's very proud to have written the first children's book in the world about stem cells. He'll sometimes joke, he says, copies will be available at the end of this session, this webinar session. David is not an MD. That gives him, in some ways, a greater latitude to speak on behalf of any of us that are exploring this possibility of treatment with stem cells. The disclaimer is standard. Of course, you should always consult a doctor before getting any treatment. And the information presented here is for, as I mentioned, it's for educational purposes. It's based upon our collective experience and research. Now, without further ado, David, we are hearing that there has been a breakthrough, and this is significant, a breakthrough for possibility of stem cell treatment for those that have hearing loss, hearing impairment. Could you describe, for those of us in the audience that might not know a lot about stem cells, describe what stem cells are, what the background and history is, what the development of the, you could say, the various treatments for stem cells around the world, you know, what has occurred over this last number of years. Just give us in a few sentences the big picture of what we're talking about here when we say stem cell therapy.
Sure, Duncan, and thank you for having me on this webinar. It's a pleasure to be here. Stem cells are essentially part of the body's natural healing system. They are utilized along with healing factors and nutrients, cytokines, messenger cells, in order to regenerate parts of your body, rejuvenate parts of your body, and take damaged tissue and heal it. And this can be applied for many different types of conditions, chronic and terminal conditions, conditions which were previously believed to be untreatable, even unrecoverable. So there's many different kinds of stem cells. There's a lot of fur and news coverage for embryonic, but there are scientific limitations to embryonic stem cells. So we like to focus on adult stem cells. And those can be found in umbilical cord, in bone marrow, peripheral blood, many places. And they can be utilized by scientists and doctors to really jumpstart the natural healing process, actually the capacity for regeneration that we all have. And we have it very powerfully when we're younger, and it gets diminished over time because of age, because of atrophy, because of environmental factors like what we're eating and what we're exposed to, and also genetic conditions. So the implementation of these stem cells can help jumpstart your regeneration and your recovery from many conditions. The case of hearing loss has been really quite tragic and erratic because for a very long time the capacity for recovery from hearing loss was something akin to a 50-50 chance of significant improvement. We have our successes. Chloe Soul was one of them. She was 18, a music student at university, and her parents were doctors. And she received stem cells and attained 95 or more % improvement. But this is very atypical. She's the exception to the rule. So for a very long time, hearing loss patients did not have a viable, i.e. a greater than 50% chance of attaining recovery from stem cell treatments. And this is what we're here today to learn about, because I think we have some exciting things that the Dr. Toot will expand on.
Just before we move on to speaking with Dr. Toot, and I would love you to, how can I ask this, to identify some myths that exist in the mind of many of us about stem cells. The specific question is, what do you think is the #1 myth? And is it a true myth or an incorrect myth about stem cells and stem cell treatments?
Well, the #1 mainstream myth would have to be that embryonic are the only viable stem cells for treating patients, for healing patients, for treating diseases, when that's in fact not true. There's about 3,000 clinical trials showing safety and efficacy or effectiveness of adult stem cells.
So I have a chat going here on the side, and there must be 4 of them, and I'm not taking any further. And they essentially are saying, do stem cells create cancer? Very simple. I mean, I think we're at a very basic level here. So yes or no, stem cells create cancer or not?
Well, the answer is a bit mixed because some stem cells do. Stem cells inherently, every cell in the body comes from a stem cell. So cancer cells, of course, come from evolved from a cancer stem cell. But in tens of thousands of patients treated, there have not been incidents of cancer being created in many of the stem cell types that we're talking about. Embryonic, certainly, but the adult stem cells, not. It's just not the case.
Thank you. Yes, Dr. Tu, could you introduce yourself, and then I'd love to hear a little bit about the clinic, and perhaps David would have some questions for you.
Okay. Thank you so much for inviting me to webinar. My name is Dr. Tut. My full name is Dr. Thane Tut. I'm the medical director here at Stem Cells 21 in Telehealth Plus Clinic in Bangkok, Thailand. So we have been in Thailand, in Bangkok, where we are right in the city, right in the central area where we are located in the CBD. We call it the Central Business District, where all the five-star hotels, shopping centers, coffee shops, restaurants, bistros, and all sorts of, you know, walkways, parks are just surrounded around our area. That's why this is the choice that we made the decision to be here right in the center of Bangkok. So we started our clinic since 2011 after our founder and the owner, you know, he had a very wide experience, you know, communicating with several stem cells, you know, organizations and stem cell treating centers to come up with all the ideas how to, you know, treat the, you know, health problems that patients have no other options for their treatment. So after making a decision with the partner, then we decided to set up this 2 levels, you know, IntelliHealth Plus clinic on the 7th floor, and on the 2nd floor, which has our state-of-the-art luxury clinic, we call it. So in our clinic, we have 2 operating rooms, 1 laboratory to process the stem cells, and 1 cryo storage room, a compound pharmacy, sterilization room, doctors and the nurses changing room, and we have 5 you know, VIP suite rooms for treatments and for observation after processing or after doing a mini liposuction. And we have 6 consultation room with nurse stations and so on and so forth. Yeah, this is the state of the art, and our operating room and our laboratory is we call it the class 10,000 sterility. Class 10,000. We use the most high technology, the same level that we use in the hospital. Also, there's no such clinic in Bangkok except from the hospital operating rooms that we have the OR room. We call it the operating room that we with a very high standard quality of sterility with no incidents. Yes.
Wonderful, wonderful.
And
David, I wonder if David, if you'd like to ask a little bit and more specific questions, David, in regards to the clinic, and then start looking at this area of hearing loss protocol.
Yeah, well, I'd love to dive into the hearing loss protocol, and if I may ask some questions about that. Can you describe briefly the protocol, the type of stem cells that are used, and why those stem cells?
Yeah, so especially for hearing loss, and you have to understand that some patients have not only hearing loss. The hearing loss sometimes comes together with tinnitus also. A lot of patients, we have tinnitus, very, you know, 80–85% of tinnitus, that they are really, really annoyed by hearing the sizzling sound. It's a sound like, you know, what you call like air coming from the, you know, a tire, sizzling sound. It starts from morning until evening. That's tinnitus. And of course, with partial hearing loss, or with, you know, 75–80% of hearing loss. So we started treating tinnitus, 80–85% of tinnitus, with hearing loss, 40–50% of hearing loss. We start treating patients with this condition, and we found out that, yeah, not only tinnitus, and we can they can improve the hearing loss also. That's why we treated patients with hearing loss, about 80%, 85% of hearing loss, where they have the inner, ear cells, the hairs have a problem that's not, sending messages, to the brain that can read or, sense the hearing. So what we are using in our clinic is most of the time we use the purified cord-derived mesenchymal stem cells plus the CD34. So this really improves the hearing plus the tinnitus. How we treat our protocol is we will use the MSC, we call it the mesenchymal stem cells plus CD34. We give the patients intravenously. Either it's going to be 20 million cells or 30 million cells of MSC plus CD34. So depending on the patient's condition, we will make a choice. We will give either 20 million or 30 billion cells. So when the patient comes to our clinic, so the cells are given intravenously and local injections. So intravenously, that means we give through their vein, we puncture the vein, and we give intravenous infusion up to 5 to 10 minutes of mesenchymal cells, and we give it on the first day. Then followed by, on the same day also, we will give a local injection around the ear. That means in the the tragus in front of the ear near the mandible. So we do the injection right here in front of the ear, and just what we call it the meridian point, the acupuncture point, where we inject the stem cells in front of the earlobe, and some are injected inside, not inside the ear, but inside the the ear. So we'll do 2 injections here and about 3 injections in front of the ear. So it depends on whether it's one-sided or both sides. So we inject both sides. So for both hearing loss. And apart from that, the most important thing is we are giving not only the stem cells for hearing loss or tinnitus. What we are giving here is a supportive treatments, that what we call it the IV intravenous medical laser. It's a German technology that was invented by Dr. Weber. That's why we call it the Weber medical laser. So we give this medical laser. It's very, very effective. It increases the immune system. We use three different what you call the lights. The medical laser, some patients, they are confused. Sometimes they may confuse that, oh, is it for surgery? No, it's not for surgery. The medical laser is it emits the light from the fiber optic. We use the red light, the green light, and the blue light. So these 3 lights, we give it intravenously every 15 minutes for each color. Red 15 minutes, green 15 minutes, and blue 15 minutes. Those colors will increase the hemoglobin level. It will enhance the stem cells that we inject, that will go into the proper area that needs to repair and regenerate the damaged tissue or organ. And it will increase the nitric oxide release from the epithelial lining of the cell and epithelial lining of the vessels, and it will reduce the viscosity of the blood. So that is very good for even patients with high viscosity of blood, there where they have some coronary arterial disease. It will reduce the viscosity of the blood, so it will prevent for them to have heart blockage of the coronary arteries. And definitely the medical laser will boost up the immune system, and it will give you a lot of energy. That's why in combination of the stem cell, this is the supported treatment that we give every day, each and every day. If we are treating the patient for 5 days, the patient will give this medical laser plus the oxygen therapy 5 continuous days every day. But the IV infusion within this 5 days treatment program or 7 days treatment program, we will give them 2 to 3 IV infusion, and we will give local injection around the ear we will give 2 local injections around the area to the meridian points, acupuncture points. So after we inject the cells around the ear, so this medical laser, we will give external medical laser around the ear also. We have all these injection points around here. Then we will stick the external laser points here. Then we'll give the multicolor laser for each ear for 50 minutes each. This
Dr.
takes
Turk,
around.
I have a chat question, if I can just interject.
Yes.
Someone is asking, why not inject all the cells at the same time? Could you answer
You
that?
mean? Oh yeah. Okay. We inject the cells, in different days, different levels. We want the cells to go to the proper area together with the cells that we have in our body. So you have to know that once we inject the cells into the circulatory system, so the cells that we inject and the cells that the patient have in their body, because everybody has the stem cells in the body, so the cells that we inject will invite and will initiate the cells together with the cells in their body to go to that proper area. So at one time, we do not want to give at one time to use the stem cells. So we initiate, we call it a low dose, or we call it a multiple injection protocol. We don't inject 30 million of cells at one time, and it's going to be one-day treatment. And no, we don't do that. So we calculate according to the body weight, and we will do either 2 infusion or 3 infusion of the stem cells plus 2 local injections. But the local injections will be on the same day that we give the IV infusion. So it will go together. And not only that, after the medical laser, what we give is we give the condition-specific growth factor peptide. These peptides has a lot of growth factors. They have cytokine effect, and they will go, and it acts like a guide for the stem cells that we inject to go to that proper area. So the peptides are injected not intravenously. We inject the peptides, the growth factor, intramuscular. So at the same time, we inject the stem cells intravenously, intramuscular peptide injection, and local injection around the ear. So the peptide that we inject, it's a specific condition-specific peptide. Those peptides will guide the cells that we inject together with the cells in the body to go to that specific area, to get to that area, and to repair and regenerate the problem. That's why we don't inject at one time the 30 million or the 20 million cells.
It's a very thorough answer. Thank you.
So this is very much, if I can completely understand this, this is very much a holistic approach towards treatment. You're injecting stem cells into the ear, of course. You're injecting stem cells into the entire body through intravenous. You're using the Weber medical laser in order to increase the immune system and hemoglobin. You've got the oxygen therapy. You're utilizing an extended therapy technique so that it's over a period of time, and the body can assimilate the cells, and the body can utilize the cells and go where they need to go, which gets assisted by the peptides, the growth factors. So it's really this one treatment is 6 or 10 or 12 different treatments, all attacking the problem from a different direction towards the same goal.
Yes, correct, definitely. That's why we call it it's a combination of treatment, and we always call it supportive treatments that we always give. Not like any other stem cell centers that they don't give what you call the medical laser or the oxygen or the peptide. Mm-hmm. What they give is only the stem cells IV infusion, or mm-hmm. or if it is for the spinal cord, they will give intrathecal injection and local injection. That's it. Sometimes they give, I've heard about some other centers that they give only one stem cells intravenous injection or 2 intravenous injection, and that's it. Only 2 days treatment. That's.
Mm-hmm. Well, this is very exciting to me, and one of my questions is, why is this protocol so different from all the others? What has changed that over the past almost decade we could only get a 50-50 result? But I think you've just answered that question and very well, attacking it from so many different angles with so many different techniques, all cumulative and complementary and building on each other and assisting each other. It makes perfect sense. That's great.
Yes.
I do have a question that's come on the chat. It said, how did you figure it out? I think that means how did you develop this protocol?
Oh, yeah. So every protocol that we develop depends on, it takes a long time after treating many patients. So that's why we found out that giving intravenous plus the local injection around the ear and additional the medical laser around the ear. So day by day, month by month, year by year, then we found out that giving treatment without the without injection around the ear or without medical laser, what is the improvement? Only IV infusion. What is the improvement? So less improvement. So we combine the injection around the ear. So where the acupuncture point that is, and then these patients get more. The effect is very, very good, and they seem to get the improvement much faster, and they improve better results than giving one IV infusion. So if you look at the IV infusion, right, all the stem cells, when we infuse the stem cells intravenously and with the peptide injection, that will guide the stem cells to where the area of the problem is, that we are talking about ear. So it will go to the inner ear hair cells, that they will go over there. But some of the stem cells, what if the patient has other problems in the body, like let's say diabetes, right? DM.
I wanted to ask that question myself. That's very good.
That's on my list.
I'm glad you're responding to this. Okay,
yeah.
Please.
So that's what I'm going to tell you is, once we inject the intravenously, so you have to know that the cells are going into your circulatory system. Once the cells are going into the circulatory system, the blood goes through all your body, right from the big vessels to the medium vessel to the small to the capillaries, into your skin, eye, brain, liver, lungs, pancreas, the kidney. Just mention all organs. Without blood vessels, they cannot live, because blood vessels are the main what you call supply for nutrients, oxygens, and any other enzymes, antioxidants that they carry to that specific organ to protect and to protect from being destroyed or damaged by any other infection. That's why when we inject the stem cells intravenously, of course, some will go to the ear with the peptide, assisting to go to the some will go to where there is inflammation. Please remember that stem cells always go to the area that has inflammation. So at the same time, if that patient with hearing loss has any other infection or let's say he has a knee joint inflammation, hip joint, or diabetes, those cells will still even go to those specific area where the inflammation is. And when we talk about diabetes mellitus, type 1, type 2, we call it the inflammation of the pancreas. So where the pancreas has inflammation, so the islets of Langerhans that needs to produce insulin, insufficient insulin that they cannot produce. So some of the stem cells will go to the pancreas where they repair and regenerate the problem, the islets of Langerhans. Then, so these patients will notice that their diabetes has improved. So how do they know that the diabetes has improved? That means when every diabetes patient have to check the fasting blood sugar level every morning or evening, right? So they will notice that their blood sugar level is controlled after so many weeks, months. Then they have to reduce their intake of the metformin or insulin injection. The same thing with hearing loss or anything, that they will notice, and they will know how they are improving. That's why I would like to mention that when we give stem cells by intravenous, it will go to the whole body. If patient has some kidney, liver, or eye, or we have many patients that after the stem cells they come for rejuvenation. When they get the stem cell only intravenously, even their face, they glow. They get rejuvenated with not even without injecting the stem cells, with the PRP on their face. Without injecting, they change. The face changes. Their hair becomes much darker. Gray hair becomes darker. The hair grows. They get more energy. Because of the immune system, and the energy is building up in the body. That's how the stem cells work when we give intravenously. It goes to every organs. Especially it goes first to the lungs, then it goes out from the lungs to the other organs, then back to the heart. That's how we can treat heart patients also.
A question has come up, and it says, will my cells get used up before they get to my ears?
Yeah,
will my cells get used up before they get to my ears?
That's why we are giving the specific condition-specific peptide. So if the patient have diabetes problem, we will give the pancreatic peptide. So that peptide will lead the cells to go to the pancreas. If it is for the liver, we have a specific peptide. So for the ear, we have specific peptide, like thymus and other peptides that we use to initiate and guide the cells to go to that specific area. Definitely. So if we use the peptide, 80 to 85% of the cells will go to that specific area.
David, any questions?
So you've mentioned some of the beneficial side effects of especially the IV implantation of stem cells, the rejuvenation of the skin, the fuller hair, the healing of the knee. All over the body there can be benefits. Many of my patients are skeptics of stem cells, even still, after reading everything that they have. Not a big surprise, because the U.S. media is sending out huge misinformation campaigns. But I have to ask the question on their behalf: are there negative side effects associated with this treatment protocol?
No, we have not seen one single side effect from this protocol. So the only side effect is it doesn't work. That's it. So we haven't seen patients it doesn't work. It will work in a percentage, right? It will work. It will improve 40 to 50%, or 60 to 80 to 70%, 75, 85%. It will work. So what I would like to tell tell all the patients, when we give because I just mentioned that when we give the intravenous IV infusion of the stem cells, right? Yes, of course, some will go to the joint area, some will go to the pancreas, but not all will go to the joint, because if the patient still has osteoarthritis of the knee joint, we give intravenously plus local intra-articular injection to that specific knee joint area, whether it's the right joint or the left joint, knee joint, or whether it's the left hip joint or the right hip joint. So we will always combine with the local injection that will be more effective rather giving only intravenous injection. That's why for patients with hearing loss, they don't need to worry whether their cells will, whether all the cells will not go to the specific, to the ear or not, because we are giving intravenously plus the local injection to the ear, plus the peptide. Definitely all cells, 85% of the cells will go to that area.
Thank you. That was, again, a very thorough answer. I have a curiosity about what a patient goes through from the time they get off the airplane until the time they get back on the airplane 5 or 6 or 7 days later. Could you walk through the steps so that we could understand that?
Okay. So every patient that communicate or contact us through our website or through our friends. So the first thing what I will do is I will always ask them, the first step is their medical history, a summary, medical reports, whether they have any x-ray or any, if it is for hearing, that we have to get the hearing report also. So all those reports will come to me, to my attention. So after going through the medical report, then I will discuss with our treating doctors here. We have many treating doctors here. We have many specialists here. We have the ophthalmologists. We have the treating doctors for the ear. We have the neurosurgeon. We have the plastic surgeon. We have the aesthetic doctors, physiotherapists, everything. Every doctors, every specialist we have in our clinic under one roof. So I will discuss with the doctors who are concerned, and we sit down together, we brainstorm, and we make a treatment plan. After the treatment plan is being finalized, then we send it to the patient. This is the treatment plan, 5 days, 7 days, or 9 days, or 2 weeks treatment plan for you, sir. Then we have to wait for their decision whether they want to get the treatment or not. Once they decided to get the treatment, and of course, it mainly depends on the pricing, the cost, what is the cost, what is the package of the treatment, then we always give them this information also. Once we get the final decision, the next step is we will make a booking date for them. Then they have to come and they will send us a booking date. That means we want to come during this period, this month, this week. Then we will book it. We will block that date for that specific patient. Then the next step, I have 2 international patient coordinators that helps me to send all the information, quotations, pricing issue, and the treatment plans that we send it to the patient. And they will also send the pre-operative instructions and the post-operative instructions that the patient has to follow. So in the pre-operative instructions, that means the patient should stop smoking, stop alcohol, stop drinking whiskey, wine, stop, the garlic, blood thinner, whatsoever. We give all the information. They have to stop 7 to 10 days before they come here, except for patients on high blood pressure like hypertension, or any patients on heart disease. They still can continue those medications specifically. So that's why we always ask them their medication list. So once we get the medication list, then we will take out these medicine that you can continue. Please stop these medication. Then we will just send it back to them. Once they get this one, they always follow the instruction. Then they will send us the flight details. Then once they arrive in Bangkok at Suvarnabhumi Airport, the Bangkok International Airport, we will send our staff and the driver, our limousine pickup on their arrival. The pickup is always at gate number 3 at Suvarnabhumi Airport, one of the biggest airport in Bangkok. So we'll pick them up on their arrival. Sometimes they have their contact numbers. We communicate each other, or they will communicate with our staff. So once we meet them, we greet them with their names with a whiteboard, and we bring them with our limousine to the Aegis residence and hotel. That is the place, accommodation. We always put them just beside our clinic. It's a matter of only half a minute walk, 30 seconds, or you can say it's about only 50 steps from the entrance of the hotel to our clinic downstairs. Then they will be greeted by the next day. Before they come, we will ask them to, if they are going to get whether it's going to be the purified cord-derived stem cells. They don't need to fast. Then they will come to our clinic in the morning about 10 a.m. in the morning. Then we greet them. They have to register in our clinic, and we ask them their passport, everything, all their particulars. Then we start to do the vital sign check. After that, the patient is brought into my room together with other doctors. We start the consultation. All the medical histories whatsoever they have to, it's a Q&A. We start consulting with the patient, the history, the medical problem, when he started the problem, how severe is the problem, then all the signs, symptoms, then related. Then we make a decision that we make some of the decisions, the treatment plans can be or will be changed after consulting with the patient, right? Because before we don't know what the problem is, but after seeing the patient, in live, that means after physical examination, testing, and everything, then we might change some medication or treatment procedure if we need to do it. So after that consultation, then we bring them to our VIP suite room and we start the treatment program. That goes for what I mentioned, intravenous IV infusion of the cells. We will give them either it's going to be MSC 5 million plus CD34 5 million, 10 million together on the first day, and with the local injection, maybe we will inject 2.5 million on one side and another 2.5 million cells on the other side. That use up about 5 million again on the first day, combined with the external medical laser around the ear, and we give the intravenous medical laser and oxygen therapy on the same day. So on the first day, and we also give the peptide injection, intramuscular injection on the first day. We'll give the peptide injection is every day that we give the stem cells injection, we'll inject intramuscular peptide injection also. That's why the first day may take around about 3 to 4 hours time in our clinic. So after 3 to 4 hours, the treatment is finished. Then we'll check the vital signs are always checked every 15 minutes with our NIPP monitor, and the blood pressure, pulse oximetry, the oxygen saturation, the heart rate is always checked every 15 minutes while they are in our VIP room. So before they go back, we'll do the final checkup with our doctors, come and greet and see. Our doctors are always visiting the patient every half an hour, every 15 minutes, depending on the condition. So most of the time we check, we follow up, with them and come and see the patient every 30 to 45 minutes to see whether the patient is comfortable. And in our VIP suite room, the suite room is like a 5-star hotel. I would say that, you know, seeing is believing. You know, when the patient comes here, they always say, wow, our clinic is so, you know, luxury, upscale clinic, and our VIP rooms are equipped with, you know, high-tech, you know, entertainment, TV monitors. We have the coffee makers, coffee machine. We have the snack bar inside our patient room. We have the toilet and the bathroom also attached in the VIP room. Not only a VIP small room, so it's for privacy also. They can take a bath, they can take shower, they can go to the toilet, not needing to go outside to the public toilet. That's why we call it the first class, you know, luxury clinic in our clinic. It's a IntelliHealth Plus clinic. So after the end of the day, final check, then they just go back to their, you know, residence hotel and take a rest. Then they have to come here every morning, every day to get all the supportive treatment. Like the second day, third day is the IV medical laser, you know, IV oxygen therapy, and sometimes we will include the enzyme treatment also, subcutaneous, you know, enzyme injection for the patients when, according to the clinical condition, we will give all the treatment. So it's going to be 5-day continuous. Within this 5 days or 7 days, we will give 2 intravenous injection and 2 local injection plus the peptide injections. That's after they have, you know, been treated. Then we will tell them how to take care, post-operative instructions also, what not to do, what they can do. Then by the end of the day, after the treatments are finished, then we organize for them to take them back, a farewell to them, and give them the information that they need to follow up. They will see some improvement within 2 to 3 months time. You know, some improvement. The improvement in stem cell is not a magic bullet, so they cannot see the improvement within even weeks or days or weeks. So it takes, you know, 6 to 8 weeks to see some, you know, gradual improvement. From that time onwards, you know, optimal improvement, you can see it within after 3 to 4 months. Then after that, if they see the improvement is coming up, you know, they see the improvement, we always recommend them to come back for a follow-up treatment at least 2 to 3 times for the hearing loss. And especially for all, you know, diseases also like diabetes, for osteoarthritis, we always call them within 3 to 5 months to come back to get the booster injection. That will help them to improve the quality of life. Yeah.
That was so thorough. I would love, just before we close, if you could think of one patient, a real patient, and just describe him or her and what their experience was, so that we could get a personal sense of what it's like.
We have one patient with you know, I would say about 50% hearing loss and about 85 to 90% tinnitus, right? This patient we treated with purified cord-derived MSC and CD34. Now, after treating this patient, he was the first patient that we treated with our stem cells. And for your information, this patient has been going around the world to get treatment for his tinnitus and hearing loss, and he has spent hundreds of thousands of dollars with no improvement. So after he came here, he got the MSC, CD34, mesenchymal cord-derived, you know, stem cells. After stem cells infusion and local injection, plus the medical laser. So he has seen very much improvement, especially in the tinnitus plus the hearing, after 2.5 months to 3 months. So every morning I ask him, what is your improvement? How do you feel every morning and day? And he told me that sometimes when the tinnitus comes up in the morning, it will stay the whole day, and it's so disturbing. Sometimes, you know, patients, they want to knock themselves out, you know, and that's what I was saying.
Oh, we lost the audio there for a moment. So, there, Dr. Ted, continue on with the story of this fellow. He his
Yeah,
tinnitus was hugely improved.
yeah, it was very much improved after 6, 7, 8 months later, after getting the second treatment. Then his tinnitus was just like, it has improved about 75 to 85%. Before it was terrible. And he noticed that every time he drinks a lot of beer during the evening, the next day is terrible. He gets tinnitus is the worst. So I even told him, if you have noticed something that makes your tinnitus worse or your hearing worse, please refrain from anything, whether it's food or any object, or whether it's the radio or listening, or now is his beer drinking. So he tried to cut, his drinking beer to half or 1/3 of the amount. Then his tinnitus has really improved, and he's very much, he's very happy to see the result after 1 year now. It's almost 1.5 years now.
Oh, that's I mean, that's
Yes.
so exciting to hear.
Yeah.
One last question.
Please, all the clients, all the patients with hearing loss, please understand that stem cell is not a magic bullet. It takes time. It takes time. It will, improve your quality of life. It will improve the hearing. It will improve your tinnitus problem gradually. So please do not get, upset or, stressed, after you don't see any improvement within 2-3 months. Also, please wait for the time and please follow our instructions. Then come for a second injection, whatever we recommend to the patients.
Thank you. Yeah, I assume you treat patients from outside of Thailand and presumably America and beyond. Where do your patients come from?
Most of our patients are from Thailand. Not only from Thailand, we have a lot of patients from overseas. Let me tell you this, most of our patients are from overseas. And we have hearing loss and tinnitus patients from England, from UK, from Denmark, from Portugal, from USA, from Singapore and Malaysia. So all these patients are, from all overseas, and we treat all international patients, not only local patients here in Thailand. And of course, Don Margolis from RSCI, we have a plan, and I've already, promised him that we will give at least, 5, 6, or 7 slots between May and end of June for RSCI patients to come into our clinic. Whenever they are ready, we are ready to treat them. All the best.
I understood that from Don Margolis, that, and I'll just reiterate that so that everyone has a chance to get that, is that we have up to 7 slots that the doctor has made available just for Don's referrals through the RSCI. And what we can do, David, I understand that you are going to be available, and I also can help you in any regard. If you'll see a button that's below the screen that you're watching, if you would like to be considered, if you'd like more information and would like to be considered for one of those 7 slots in May until the end of June, touch that button there so that we know, so that we can be back to you one-on-one and begin this process of collecting some medical information to be able to pass on to the clinic. Our time is up. I want to thank you both very, very much. Doctor, you've been so thorough in your
Thank
responses.
you so much. It's my pleasure. It's our pleasure. Yeah, on behalf of Stem Cells 21 and Telehealth Plus, the family and the team of specialists and doctors, welcome, and we wish all the patients the very best for their health.
David,
and we look forward to see them soon
very
in
nice.
May and June.
Okay, David, any parting words for our viewer?
Well, thank you for Dr. Toot, and thank you for Duncan. This is very exciting to finally have a hearing protocol that creates such a overreaching and expansive methodology for treatment that gives a high return of results. So it's very exciting. I know there's a lot of people who are going to be trying to get those slots because I've talked for years with patients who say, anything for hearing, anything for hearing. So I'll be happy to report back to them. Thank you so much.
Yeah,
and
thank you so much.
And to you, our viewer, I want to express my appreciation to you to listen to this seminar, this online seminar. Again, touch the button below so that we know we can be back in touch with you directly, one-on-one. Everybody is unique, and your situation, of course, is unique. And of course, the RSCI would want to respond to you individually because of that. Thank you so much.
Okay.
Good
Thank
day.
you so much.
Good night.
Thank you, Duncan. Thank you,
Thank you.
David.
Yeah, very well.
Have a nice
Thank you very
day.
much.
Bye-bye.
Goodbye all.
Bye.
Bye-bye.